I have to introduce you. Ed's first line of his bio is he's a physician, scientist, educator, and public health advocate. I think that sums it up. He comes to us from Harvard. He is at Mass General, where he is a professor of immunology and infectious diseases. And I won't give you all of his titles because it's remarkable. He basically has a number of grants looking at advancing global health in low resource settings. I already told you that he directs the Global TravEpiNet program, of which this is a part of. He's an incredible collaborator. He's an incredible, generous physician. I think, he's a leader in everything he does. Not enough things, but I do want to get to the panel. Ed, thank you. So we're going to start. I am the leader of this panel. So we're going to start this panel. And there was a question in the box, Lynn, with Lynn. And she's going to lead this off. And we're going to be approaching this, but we can go in any direction. So I'll be looking at the chat. So you can ask anything you want. And if something wasn't answered during the questions, we can also answer it then. So we're going to be saying, what is a travel medicine career? And I think one of the things I want to do is, Lynn, I want you to start off with, how do you get trained in travel medicine? And you wrote a lovely paper a number of years ago about the importance of getting training, not just giving travel advice. And what that does for your travelers. So how do you get trained? What does it mean to be a travel provider, Lynn? And I went over that a little bit. And then I also want you to talk a little bit about leadership, but you can go back later on because everybody on the call, we can loop around to leadership. Lynn, somebody actually asked on the questions, is there a fellowship in travel medicine? So maybe you can directly answer that. I told them that I would ask you that. Okay.
Okay, I will get to that in a minute. And I think maybe I'll share a few slides. And so I think what I thought I would do is, can you see my slides? Slideshow from, can you see that?
Yes.
Okay, so well, very quick disclosures, some of the commercial interest, but I want to mention the conference of the ISTM that's going to be in Basel, Switzerland in May 2023. Mark that. So I think when Chris asked me to talk about this, I started thinking, what are some of the key elements that we might want to think about? And what is the background? What are the backgrounds that are suitable for travel medicine? What are some of the resources to help develop a career in travel medicine? What are some specialized training that's available, that are available to work in travel medicine? And can you still see my slides?
Yes, Lynn.
Okay, and also networking. What organizations offer opportunities for career development or advancement? So as far as the background goes, and I will get back to the fellowship question in a little bit. And as far as background goes, I think you've heard from Rebecca, who has the nursing, master's in public health background. Ed, who's ID physician. I'm trained in general internal medicine, did an ID fellowship, and then just pursued a travel tropical medicine route. And so you will see a lot of people from all different backgrounds doing travel medicine, and a number of people who have public health training as well. And so then I started thinking, my career really started when I was in ID fellowship and had mentors who were very interested in travel and tropical medicine. And this was at Yale. And Michelle Berry, who is now Associate Dean of Global Health at Stanford, we had lots of shared interests. And then Frank Bia, who is Emeritus Professor at Yale. And started with just reading a lot about different questions that come up. with all the cases that whether they were malaria or typhoid or these travel-related diseases, or going to the parasitology rounds, looking at slides of various parasites and thinking about their life cycle and the exposures and the epidemiology. So everything that you do, everything that I've done added up and cumulatively to where and sort of took me along the path. And then after that, I met Mary Wilson, who has become an amazing mentor. And then and I at one point I was doing working in the walk-in clinic and doing general internal medicine and covering ID from time to time and doing travel and tropical medicine clinic all at once. And that was at Leahy Clinic. And Mary Wilson invited me to come to Mount Auburn Hospital to direct a travel medicine center. And that was a great opportunity to be able to focus more in this field. And so I think the writing, the reading, the exploring and talking with people with similar interests really then led to many other activities. And I would also say ISTM, International Society of Travel Medicine, when I started going to the meetings, and I alluded to that, it's a very friendly group of people and environment. The American Society of Tropical Medicine and Hygiene is another one that is has amazing resources. And so every time a question came up, are you looking at the slide that has the CDC Yellow Book on it?
No, we're not. Yes, yeah, but
Okay.
but two are coming up actually.
Okay.
It's not a complete. Yeah,
Can you see that?
much
Okay.
better.
So, so every time questions came up, I would go to CDC, either the website nowadays, the online version, or flip through the CDC Yellow Book, which has amazing guidance. And then the Pink Book that Rebecca talked about has all these guidelines on immunizations, vaccine preventable diseases epidemiology. Jay Keystone led the this textbook on travel medicine with many different chapters with all the answers you need. And if you need really detailed questions, or if you have really detailed questions and even very obscure questions, the vaccines textbook has it, and then another practical textbook. And then every couple of years, there is an update on general best practice guidelines for immunization from the CDC ACIP. This was just updated in May of 2021, and it's available online. So for the complicated patients that you might have with vaccine questions, it's all in there. And then, so then I mentioned the CDC Travelers Health, which contains the Yellow Book, and I think Ed is an editor for this, and it has so much information. And for our travelers, we often send them to this website, and they can look at where they're going, get some basic information. And for clinicians, they can also look up what the CDC recommendations are, and whether it's vaccines or epidemiology or malaria prevention or discussions about travelers diarrhea. And then, so when I think about what I would do if I were starting my career, was starting to explore career in travel medicine, this learning website at ISTM is wonderful and has a lot of past modules and lectures and monographs that you can explore. There is a course, and I believe Dr. Flaherty might talk about this later, but I'll just put that out there. And then there is a certificate of travel health that which is from ISTM, and it's an exam that Dr. Coyle mentioned, and that gives you a level of confidence in what you're doing, and also with joining the group of people who have more expertise in travelers' health. So Chris talked about the study that we did. It was actually Laura Kogelman at Tufts Medical Center that led the analysis for Boston Area Travel Medicine Network. And we did surveys and had case scenarios, and this went to travel medicine providers, also to primary care doctors, and anybody that did travel medicine. And what we found was that people who responded correctly and based on the guidelines for these various scenarios, travel scenarios, also had more education, who did more education in travel, more specific to travel medicine, whether it's vaccines or the courses or the certification. And so I would encourage people to explore that. And then some programs, so this goes back to the question about fellowships. Then these are some of the programs with faculty in travel medicine. So Royal College of Physicians and Surgeons in Glasgow actually has a dedicated faculty in travel medicine. So you can search that. And then University of Minnesota Clinical Tropical Medicine and Online Global Health Curriculum. They focus on tropical medicine, but also has travel medicine modules as well as global health modules. You can do it online, and they have some in-person component as well. The Mahido has a tropical medicine curriculum, and that includes some travel medicine. And interestingly, Mahido does have a travel medicine, I think it's a residency or fellowship. It's for their own residents. I'm not aware of international residents or fellows going there for that particular certification, that fellowship. But Gorgas course in tropical medicine, David Freeman has been the co-founder and director of this course for a long time, has wonderful in-person teaching, and there is a certificate that you can sit for, London School of Tropical Medicine and Hygiene. So these are just a few of them, and people have different needs and different interests, so look at those. And then in terms of other entities and organizations, if I were starting now, I would look at, in addition to ISTM, in addition to the CDC's website, travel website, FASTMH is another one that has a focus of a group that focuses on travelers' health, and advisory committee on immunization practices. ACIP, as you know, does a lot of the vaccine evaluations and recommendations. And then International Society of Infectious Diseases has a lot of alerts on outbreaks. And that's really important when we're seeing travelers beforehand, preparing them beforehand, or after return and evaluating the ill persons. Immunization Action Coalition, Rebecca mentioned, has great resources on vaccines. And then the Shoreland TravEx, my conflict of interest, I do serve as medical advisor for them. It's a subscription service, has very comprehensive information for operating your travel clinic. And then key international organizations with related guidance would include WHO, the UK NASNAC. They have their versions of recommendations for the UK travelers. The European CDC has information, and as well as epidemiology. So all of these have some overlapping epidemiologic interest. And Committee to Advise on Tropical Medicine and Travel, which is CAPMAT, a Canadian group. And then the European Society of Clinical Microbiology and Infectious Diseases. I think I forgot IDSA. IDSA did set some guidelines, and they also have a lot of relevant guidelines for travel and tropical medicine. So I think I will end there.
So the difference between Lynn and I. So I would have done that from my memory. So people are already emailing, can we have these outstanding resources? And I'm actually saying, and I'll say it offline to you, Ed, we should actually maybe put them on one of the websites, like either, because this is really remarkable. So Lynn, I'm not going to open it up. Before Ed, Ed is going to talk a little bit about research. Lynn, thank you. That was remarkable as usual. And as usual, thorough. And we need to talk about how we can get that out there, because that's a great list. So Ed, you are doing some really interesting projects with travelers. And I think this idea that you can ask a question, a research question that is answerable, is something that people don't think about in their training. They just don't get exposed enough to travel medicine. And I know my whirlwind case was a whirlwind, but I think the point of it is that travelers really tell us a lot. And they can give us insights that people in endemic regions, including people in the US, can't. So why don't you, I'd like you to talk about, I had made some suggestions, but you know how to handle this without me prompting you. So I'm going to hand this over to you.
Christina, thanks. And if I don't hit one of the things you wanted to touch base, just ping in. I guess so. Christina did ask me to touch base on sort of the impact of investigation and research as part of the larger travel package. And I do want to say that to me, it springs naturally out of clinical care, because when we care for patients, we often realize the end of our knowledge. We often say, can we give this vaccine at the same time? What actually are the data that these things interact or don't interact? Or why do we have this recommendation or that recommendation? And I take a holistic view of travel, of both pre-travel, getting somebody set to go to an LMIC setting, but also I also take this as a holistic approach of a post-travel aspect as well, of how do we optimally care for people when they come back, and interdigitate into our medical system, and how do we give them outstanding care? So for all those things, I would say the first thing is it should be pretty straightforward. Like, you come up with clinical questions every day where we don't have the correct answer. So then you want to figure out, is this something which is addressable? And it may be that you can identify things that are important, clinically relevant, and that you have the capability to address in some way. Now, if you want to get a flavor for these things, I would strongly suggest just scrolling through the Journal of Travel Medicine. There's other sources. There's the Journal of the American Society of Tropical Medicine and Hygiene, but the ones that's probably most pertinent just to get your juices flowing would be the Journal of Travel Medicine, because there's wonderful things in there, everything from individual case reports through sort of very robust, large multinational, multi-site investigations and studies, et cetera. So scroll through there to get your juices flowing about what were some of the things that might be possible or not possible. I sort of put investigation broadly, but also in travel, into a couple of buckets. And one bucket would be something, for lack of a better term, I'll call sort of epidemiology, working with data sets and looking into those. Recognize that if you have your practice, it might be very interesting to you what your practice looks like, but it's probably not that particularly interesting to other people, et cetera. So on the epi side, I think something that helps more clinically would be large case series of post-travel things. So if you are a center for cysticercosis or echinococcosis, et cetera, you have a unique ability to say, okay, in a medical system that has all these resources, how can we optimally manage these individuals, et cetera? So that's a sweet spot sort of thing. But you could probably come up with many things, outcomes research, modelings, et cetera, on the investigation. The next bucket I would put into would be sort of sampling. And so sampling would be, you take something, either a blood sample or stool sample or something, and you analyze something. So I'll give you an example. There's a couple of groups out there that do research. One of them is the GTEN program that we work with, and we collect samples on individuals before and after they travel internationally. And for instance, some of the work we've done, probably the easiest to just sort of just use as an example would be, headed up by Dr. Regina Larocque, was looking at antimicrobial resistance as people travel, and as they travel overseas, how often do they pick up? And the group worked with the Broad Institute and did deep sequencing of genomic analysis, et cetera. So it's not just characterizing microbiology, but there's also an overlay of looking at what are the risk factors for picking these up, how long do these people shed when they come back, how often do they transmit it to household contacts, et cetera. And obviously that's a sweet spot area also of, you know, stool can be collected pre and post trip at home, and you can give the person a kit, etc. And you know, so that would be a perfectly good example of a sampling investigation. You could also imagine looking at blood samples and looking at either exposure for antibodies for what's, you know, how many people get exposed to pathogen X or pathogen Y when they travel internationally. Or you could look at vaccine interactions or immune responses. You could also do swabbing. You can do nasal swabbing and look for viruses, respiratory viruses, et cetera, and do deep sequencing on those to see what, you know, use your travelers as a sentinel to sort of figure out what's circulating around out there in the world. So there's all different things that you can do under the sampling. And the last group that I'll sort of talk about is interventions. And that can be anything from let's give a new vaccine and see what the immune response is or something, but it can also be, you know, it could be an intervention to increase uptake of certain behaviors by, say, certain groups. So maybe if you have a very large West African population you're working with, you know, what are the ways that you can actually increase CDC recommendation adherence among that group, et cetera. And Christina and others have played a critical role in this, and Bill Stauffer and Danushka out in Minnesota. They're doing wonderful work, so trying to look at how can we get into the communities, how can we figure out what's relevant or not relevant, et cetera. And then you can start to put the pieces together. You could do an intervention and then look at sampling to say, does it have any impact on actually exposures or clinical outcomes, et cetera. So those are just the buckets. Once again, just flip through on the webpage, the Journal of Travel Medicine, to get a flavor for some of these things. With regard to groups, you know, so there's GeoSentinel, and I would strongly recommend, if you are interested in doing investigative work relating to pre or post travel, I would strongly recommend you hook up with one of these groups. So one is GeoSentinel, that does a lot of great work, especially in the post travel side. One is GTEN, which does a lot of work on pre-travel, but then with sampling post-travel as well for exposures. And I would recognize that I just saw yesterday across my screen that the Society, or the International Society of Travel Medicine, they actually have a grant cycle every year where people can apply, and that just got posted yesterday. So you can go to the ISTM website to sort of see what's available for applying for grants to get some research up and functional. So maybe I'll just stop there, but there's a lot of exciting, I mean, recognize, you know, as providers, and I assume almost everybody on the call is a provider of some sort. As a provider, we practice in our current reality. But if we're still practicing this way 50 or 500 years from now, then we have dropped the ball for future generations. And so we really have to not only be good at what we do, but we have to get better at what we do. So figure out what the questions are and then figure out ways to address them. And maybe I'll just stop there.
I don't see any questions. I'm looking in here. I don't see any questions or comments. I'm looking through. I will say that I think for trainees, there's some really great opportunities, like you just said about ISTM. And I think there's a lot of opportunities in travel medicine, even attitudes and practices, you know, attitudes of travelers. Now, of course, with COVID, there's a lot. So I do think for those of you that are on the call as trainees, hopefully this is giving you a lot of food for thought. So I'm just trolling the comments. I don't see anything else. So thanks a lot. And I'm going to move over to Rebecca. Rebecca, you're going to talk about what it's like to integrate a practice. So your practice is integrated in an internal medicine practice. Is that right? And so you're going to talk about what it's like to work in New York City in a private practice, giving pre-travel advice. And so you're going to focus on that right now. So Rebecca.
Thank you. Thanks so much. So the practice that I work in is, it began integrated into an internal medicine practice with a physician who had background in tropical medicine through some PhD work and so forth. And I had also, he ended up, we met working in an HIV/AIDS center where we were both working here in New York City, and we did end up getting married and had sorted out that relationship. And then we decided to start this travel medicine practice together when I left the HIV and AIDS center. I think it very typically he was, struggling to do the travel medicine, serve those needs of his patients in New York City at a big internal medicine, also still HIV/AIDS care practice, and couldn't really, efficiently provide for the travel needs. And this was also back in the early 1990s, mid 1990s, when there wasn't a lot of formalized travel healthcare. There were a couple private practices. There were some hospital-based clinics. But people were really starting to travel starting in the late 80s and 90s. And so many of his patients, his colleagues, they were all coming to him and, needing this kind of care. So, he sort of looked at me and said, well, hey, you worked in a travel clinic before, should we maybe just start a travel medicine practice as a separate entity? And that's what we ended up doing. And we sort of combined our backgrounds and expertise and set up a separate entity. So it was carved out and away from the internal medicine practice. We have shared space because there's efficiency in that in terms of rents and staffing and everything. So that works, but it is a separate entity. It has its own policies and procedures, and the staff know when they're focusing on the needs of the travel clinic versus the internal medicine primary care practice. So that has to be very well sorted out. And we basically opened up to any and all travelers. We had a yellow fever stamp that he already had that we could utilize. And, it was a big push in the beginning because, as I mentioned, then you have to really formalize everything that you're doing. And as we were developing, the client base and getting bigger and to the point where we could hire more staff, a lot of my time was spent in developing that framework for best practice and making that investment. This isn't something you can pull off the shelf. You can certainly, there's tons of resources out there, but either you or somebody in your institution or organization is going to need to really, pull that framework together for you. And you can certainly do it slowly by expanding what you're already doing. As I mentioned, if you're already providing basic level service, you can slowly begin to expand it. And we also had to be prepared to deal with any kind of traveler. And I had previous experience working in a travel clinic. As Christina had mentioned, I sort of grew up in the family bakery, if you will, because I was fortunate to have one of the most amazing mentors in my father, who was a tropical medicine person. And although I tried to get away and did go into public health and HIV and AIDS care, like many of us, I got sucked back in to travel medicine and did spend some time in the mid and late 80s helping to develop his practice and really getting more nurses working there and so forth. So I did have some of that experience that came in very handy when we started our practice here in New York City. And it also, but there's constantly learning. I think, as Lynn had mentioned, and Ed, and even everyone on this webinar, so forth, has you don't come into anything knowing everything, and you always have to keep in mind what you don't know, as I mentioned in my talk, and utilize the resources. So there's a lot of learning on the job, so to speak. But as long as you are keeping that framework of best practice and having boundaries, you'll know when you've hit a wall. For me as a nurse, that was a little bit different because I had to be careful not to really go out of the scope of my practice and consult with our medical director when there were cases that I had trouble with, consult with colleagues and so forth, to be able to provide an appropriate care plan. And we've always worked in a model, I always have, where nurses are providing most of the care in the pre-travel area. And that we do very intensive training when we hire somebody. They may come with some background already.
Rebecca,
we
we're
really
just
hello?
running out of, we're just going on to the, we're just running
anyway,
a little bit.
That's just a very quick, nutshell of me and where I am. And I'll be happy to address questions, more particular later on.
Yeah, and anyone that has questions, I think Rebecca was just getting into it. I think that nurses really drive a lot of the pre-travel, but there always is this incredible collaboration with physicians. But yet there's so much room for nursing to be involved in leadership in ISTM and other societies. I didn't mean to cut you off, Rebecca,
No,
but
no
there
worries.
people are like, I'm in the room now, and some of you are actually in the breakout sessions, and you are a moderator. So for the attendees, thank you everyone here. This was amazing. We're just trying to give you a little snippet of travel medicine in a day. So I want to thank Lynn for her slide sets, which we will distribute. Ed, thanks for your insights on research. And Rebecca, thanks for sharing this and also your earlier session, which were remarkable. I mean, I just really fantastic. And then for the participants, go on to the links for each session, and then once it's through, you're going to go on to the second link for the second. So you'll do 2 breakouts, each breakout except for one, except for 2. The pediatric one and Dr. Ryan's malaria one will be repeated. So if you particularly want one of those, go on only that one for that time slot. I will see everybody back here after the breakout session. Thank you, everybody. I'll talk to you all soon. Bye. Oh, the links for everybody, the links should be to Judy and everyone. The link should be in the, you should have gotten an agenda, and each agenda is in the link. So please look at your agendas that you were sent. We sent you an agenda, and it's got every single breakout and every link in the breakout. Okay. I'm gonna stay. My person is Gerard. Okay. Anne-Marie, I would stay on. Is Sumaita on here? Yeah, I would stay on. Yeah, because anybody else has questions, just keep on checking that question and answer. Yeah. And make sure they. And he really knows everything there is about travel medicine. I'll just leave it at that. He holds a diploma in travel medicine from Glasgow. Some people have heard this introduction. I'm sorry for the people that have been in his group, but if you've been, that's why you're here now. He includes a master's in international and travel health, a master's in med education. He has been a